Hello, and welcome to today's webinar, The Experiences of PFAS Contamination in Impacted Communities. I am Dr. Barbara Malkus, Board President for Massachusetts Breast Cancer Coalition, and I'd like to thank you all for joining us today. Massachusetts Breast Cancer Coalition is dedicated to preventing environmental causes of breast cancer through community education, research advocacy, and changes to public policy. I am pleased to welcome today's speaker, Dr. Phil Brown. Phil Brown is a University Distinguished Professor of Sociology and Health Science at Northeastern University, where he directs the Social Science Environmental Health Research Institute, and along with Professor Elisa Cordner of Whitman College, its PFAS Project Lab. The lab has grants from the National Science Foundation to study social policy and activism concerning PFAS, and with Dr. Laurel Schaider of Silent Spring Institute from the NIEHS to study children's immune responses to PFAS, to study community response to contamination, and to develop a nationwide information exchange, including medical guidance documents and continuing medical education course. He directs, along with Dr. Julia Brody from Silent Spring Institute, an NIEHS T-32 training program, Transdisciplinary Training at the intersection of environmental health and social science, and co-directs the Community Engagement Core of Northeastern Superfund research program, where Puerto Rico Test site to explore contamination threats, called PROTECT. Dr. Brown, welcome to today's webinar.
Thanks. It's very nice to be here. I've cherished my long-standing relationships with NBCC and with Silent Spring, and you'll see some of that here in the presentation today. So this is a story about the most well-known chemical contamination that we know of at present. And the reason we call PFAS forever chemicals is because these approximately 14,000 different compounds stay in the environment forever, and that gives them a chance to keep entering our bodies. It's a crisis, though, that's pretty new to national attention. It's a crisis that's also led to a lot of regulatory change, primarily at the state level, and has increased scientific research dramatically. But most importantly for us today here, it's a great example of the public's environmental health literacy and activism. And it's a model of how community activists, environmental health scientists, and social scientists can work together to do environmental public health research. And as I say, you'll find today a lot of attention to NBCC and Silent Spring's role in this. So this is the agenda. We're going to cover a lot of topics, some of them with more time and some more than others. We'll start with looking at how affected residents are central to social discovery, what the impacts are in communities, the role of activists in 4 national conferences so far, their role in medical guidance and education, different types of activism, and then their impacts on regulation, remediation, and science, and little sidebars to firefighter activism and turf activism. The main thing, like most toxic waste site crises, going back to Love Canal and to Woburn in Massachusetts, without the discovery by affected people, the awareness and action would not have happened. And here's a case where DuPont, in its very, very large production facility for Teflon and other chemicals in Parkersburg, West Virginia, bought land from the tenant family, and on their farm dumped enormous amounts of PFOA waste. And all their cattle died. They were very upset, as you would imagine, and these were multi-generational farmers who were now pretty much wiped out. And they sued, and out of that, other suits came, and DuPont settled this. And the lawsuit was not just a financial one, but one that gave enormous amount of funding to a health study and to a medical monitoring program. And that health study of over 69,000 people was the largest environmental epidemiology study to date. really sparked a very important set of findings and pushed many others to take up the research. As long as we're talking about farmers closer to home, we have a number of families in Maine who had to really shut down their farms entirely because sludge contaminated with PFAS was spread, as it is all over the country, as fertilizer. And these poor farmers really suffered terribly. They also spoke up and became very important activists. And so both Fred Stone and Joanna Davis and Adam Nordell and their farm became very, very prominent spokespeople and activists. So here's just a number of the different groups that have taken the lead in identifying contamination and the sources of that. And we'll hear a bunch about some of these today. So what is it that PFAS does to communities? Well, to individuals, it of course makes them aware that it could be the cause of their illness and could make them very worried about the future of their own and their children's illness. Sometimes it even produces disputes among different groups in the community who say, hey, if you make this into a public issue, we're going to lose business, people are going to leave town, the tax base will go down, you won't be able to sell your house, you're going to make us look bad. And that's something which has always been happening in many toxic crises. Also, people sometimes find the local government doesn't want to help them and tries to poo-poo their concerns and to make them into troublemakers and to basically gaslight them. So that can lead to distrust in government. And it is true when there is useful remediation that it can increase the water and sewer bills for people. People do have legitimate worries about business loss and job loss, the decline of their own property values, and higher taxes when businesses may leave town. They're also super concerned about what happens when they go to their doctors and nurses and say, what is this about? I found out there's PFAS in my water. I had a blood test and it shows PFAS. What am I going to do about it? And those clinicians often don't know. Mainly, the impact on these affected communities is that it spurs action, and that is our story for today. One of the things that's very, very prominent is a series of national PFAS conferences in which community concerns and activism are the prime focus. We had the first one here in 2017 at Northeastern, and we had a conference grant from NIEHS. And the committee members that organized this were from Northeastern, Silent Spring, Harvard, Whitman College, Testing for Peace, a local community group, and Toxics Action Center, now called Slingshot, which is a New England-wide group. And we had a lot of people come, 140 people from all different walks of life, everybody who had any concern, whether it was local, state, or federal government, law, business, regulators, academics, water utilities, many journalists and filmmakers, and a lot of healthcare providers as well. And this photo just shows you some of the activists on one of the panels. It had great impact, this one conference. It set the bar for what a community-centered conference could be around toxics, and it built great networks and sparked new collaborations. And in particular, the groups from around the country had time to build a new coalition, the National PFAS Contamination Coalition. Also, this was a place where some very important science was announced about short-chain PFAS, what we call the later substitute for the more traditional PFOA and PFOS that were well known. And here's just an article by Sharon Lerner, one of the top journalists in the field covering PFAS, reporting on material she learned at the conference. It was so successful that we had it again 2 years later. Why 2 years? Because it took a lot of work to get it together, and we couldn't do it every year. But it continued to be an activist-inspired, activist-led conference with activists on all the panels and really taking a key role, and having a lot of time set aside for lunches and dinners and extra meetings where they could get together and really be on their own to strategize and plan for future work. After 2 years at Northeastern, they said, we love it at Northeastern. Everybody there is great. There's a lot of excellent community groups here in town that I'm working on this, a lot of national groups as well, but let's hold it in a place that's got a lot of contamination. And so we went to Wilmington, North Carolina, because that's where Chemours was pouring out Gen X, a very important replacement to PFOA. contaminating the Cape Fear River and its watershed, which supplies water to perhaps a third of the residents in North Carolina. And even more people came that year. And they said, look, next year again, a contaminated community. And so it was in Michigan, which is an area that's got a very large number of contaminated sites, some of them from sludge, some of them from military bases, some of them from fire production, firefighting material production. The 5th conference is in active planning mode right now, and it's going to be this June in Tucson, Arizona, with community partners in the lead as well. So this is the website to check and see what's going to happen there, and we hope that this will interest you enough to perhaps attend. One of the things that's very important to our team is that medical education and practice need a lot of attention. So we developed a CME course for physicians. But the most interesting part of this is not just that it's the best CME course on PFAS, but that it was prompted by an activist group. Now, the Nantucket PFAS Action Group was started largely by the spouses of firefighters on Nantucket. And you may know in general that firefighters have high rates of cancer. Firefighters had already been active across the country dealing with the hazards from flame retardants. And so they were kind of ready and willing and eager to take on the next toxic crisis. And so this really started with initial requests from them to us to provide an hour talk at the Nantucket Cottage Hospital, the only hospital on the island. And as we got closer and closer to the date of it, they said, you know what, this deserves national attention. Let's make a video, let's make a CME course, and let's get that accredited so doctors can take this to fulfill their CME requirements. And so Region 7 of the Pediatric Environmental Health Specialty Unit, which does this kind of medical education work, paid for us to produce that, and we had in it the voices of activists as well as toxicologists, physicians, and others. And we designed it so that it was accreditable for doctors, but also useful for other clinicians and for the general public. And it's a very nicely produced video that's got great information, but also some important stories. And one of them is by Sandy Winstelt, a very key activist in Michigan. And she had the courage to share about her own thyroid cancer and said, look, if I didn't get blood tests and medical screening really early on in my disease, I probably would have died. But having gotten this attention, I was able to get the right treatment, and I'm alive and kicking, and I'm also very active for the rest of my life on PFAS issues. So you hear her voice among other activist voices on that video. So what do communities want when they discover this? They want water monitoring and treatment because they don't often know what's in that. Some water departments will give you a yearly update of what they found and tested, but PFAS wasn't one of the things they were testing for, and it wasn't required until quite recently. Once they find this out, though, they want drinking water standards, they want other regulations. They want measurements in the environment. For different people, that can mean different things. For farmers, it can mean sludge. For people who are subsistence fishers, they might want testing of the fish, which is very true for lots of Native American populations. They often want biomonitoring so that blood tests will give a more accurate understanding of what's in their body, not just what's in the water that they drink. And as I've talked about already, they want medical monitoring guidance and education for health professionals. And even though they know that health studies are expensive, may take a long time, and may not come up with enough results because the numbers are too small, they often want these health studies. But they have a lot of challenges that are in their way. Blood testing is often unavailable, very expensive, $500–600 a person to do that. Medical professionals are unfamiliar, as I said. Some states are not testing drinking water, and if they are, it's only for a limited number of PFAS chemicals. EPA, which finally in 2024 passed maximum contaminant levels for 6 different PFAS, which would be official legal requirements, have already taken 4 of those back and are threatening to take the other 2 back. And plus, fish and other foods are not tested, and there aren't a lot of opportunities for health studies. One of the nice things about our team, especially Courtney Carrigan at Michigan State University, whose name you'll see later, did a very important validation of a finger prick test where you could simply prick your finger and that would then give you enough blood to show what the PFAS level was. It wasn't enough blood to do research, but it was enough blood to detect the PFAS in your body and therefore could indicate the need for future medical monitoring and lots of other screening. And she was able to validate that as being really very close to the level of excellent medical knowledge as a large draw from a doctor or a nurse or a phlebotomist with serum. These activists are incredibly literate. I mentioned before environmental health literacy, but their activism is very impressive. And if you know about the Goldman Environmental Prize, it's basically the Nobel Prize for environmental activists. And they give out one award every year to each continent. And Lorena Allen, who we've had the pleasure of working with up in New Hampshire, was the winner in 2025. Just to give you a sense of what some of the community groups do, Clean Cape Fear was formed in response to that massive Gen X contamination from key mortars. And one of the leaders of that group is on the right, Emily Donovan. In the middle, you have one of the doctors, Kyle Horton from North Carolina, who's been very involved, and Andrea Miko from PEAS. These groups go back and forth. They help each other. And testing for PEAS, who you'll hear more about, started very early as the first really important group. And they just went around the country helping other groups form. And that's one of the most impressive things about the PFAS community activists. They've really been able to help others to form local groups as well as create a national coalition. Some of the other activities that the Clean Cape Fear did, testifying in Congress, and then you see Emily Donovan in the middle, but you also see on the right Sandy Winstelt, who we talked about already. And these are folks testifying at EPA and the US Congress at events like the Dark Waters film with Rob Bullock, the lawyer who represented the victims in Parkersburg, West Virginia. And at the bottom left, a very large community meeting they organized in North Carolina. Now, one of the things that activism can do is really have a strong effect on regulation. So we're lucky here in New England to have states that have been in the lead in passing regulations. Credit goes to New Jersey for being the first to regulate any of the PFAS, but we were very quick to come up right after them and to do it. So New Hampshire in 2019 proposed regulations for 4 different compounds of PFAS. And at the time, there was no regulation yet. There was a health advisory from EPA that said that you shouldn't have more than 70 parts per trillion of PFOA and PFAS combined. Now, as you look at these numbers, these proposed regulations were above that. And if you combine all 4 of them, quite high. And the activists were very important, going around the state, having community meetings, talking to the legislators in the House and the Senate of their state to change that. And they also were able to convince the health and environmental agencies to look at evidence from other states, in particular from Minnesota. And as you see at the bottom line, the final promulgated MCLs were much lower, very protective compared to otherwise. So this is one of the things that public and activist engagement can do in terms of better regulation. Here in Massachusetts, we had a very interesting PFAS interagency task force, and activists were very, very critical to this in testifying and leading eventually to quite strong recommendations. And this was all material that would be used for legislation introduced. And as we sit here today in this webinar, many of our colleagues are not here because they are at the State House testifying for the Sear-Hogan PFAS bill. That'll be a very, very important bill once it passes. But the task force heard from lots of activists who wanted to fund PFAS detection and remediation to support especially communities that were EJ communities. They wanted to phase out PFAS in consumer products, to expand regulation, to encourage private well testing and remediation, support firefighters, address PFAS contamination accountability, make the polluter pay, and to enhance public awareness. And a lot of these things they got already, and many of them are still coming in the bill. So this was the basic source of evidence. Water utility people said, here's what we need, we can't afford it on our own. activists said, we need blood testing. Everybody who is involved in this said, we need to be very forthcoming and make this state a leader in PFAS action. Now, the Alliance for a Healthy Tomorrow is the major coalition of activist groups in this state that does a lot of work around legislation. And NBCC has played a very outstanding role, a very important leadership role in that alliance for a number of years. Well, activists are very important in remediation. Here are examples from several places: Hyannis and Ayer and Pease Trade Port in Portsmouth, New Hampshire, where you see signs of the action or of meetings that are being held or the actual equipment to filter out PFAS. So these residents are playing a very big role in filtration, monitoring for compliance, and looking at the breakthrough, because some of the short chain PFAS actually are not stopped by the filters that get the older traditional legacy long-term, long-chain PFAS. Now, I've alluded so far to the importance of activism in science, but let's look at a few more things. And here we get now to NBCC's role. Silent Spring is the lead science actor in this multi-site study from the Agency for Toxic Substances and Disease Registry. ATSDR is something, it's an agency that's part of the CDC, back when there was a CDC. And they, as a result of community pressure, funded this multi-site study of 7 sites around the country. The first pilot one was at Pease Trade Port. And then they put out requests for other communities with a requirement that community groups be partners in the research. And Silent Spring won the grant to do their study at both Ayer and Hyannis. And you see here, the activist group PACE and Ayer and NBCC are the 2 community partners in this study. Another example is advocacy for blood testing. So the activists, both in Pease and also in Merrimack, which was a very large contamination site from an industrial source, supported state biomonitoring programs in New Hampshire. And the state was very quick to provide a lot of that. But the residents said, look, that's great you did that, but many people who wanted to get blood testing still didn't get it. And they very successfully pushed the state to increase the number of people getting blood testing. So this was one of the most important sets of scientific data around the country. Now this gets us to our PFAS REACH team. And you'll see some familiar faces here. Laurel Schaider from Silent Spring, Courtney Carrigan, who I mentioned from Michigan State, Andrea Miko, who you've already seen from testing for Pease, a couple of photos of her, Dana Callahan from Slingshot, and our own Charles Asimo. And some of the activists you see in the other shots on the right panel. So the PFAS REACH project was funded and still is funded by NIEHS. And as you heard in the introduction, we have a variety of things that we do. One of the things that's most important are the medical guidance documents in the CME course. And you can see them at pfasexchange.org. And just to give you a brief look at what they look like, there are fact sheets on PFAS exposure, information for patients, and guidance for clinicians. These are all designed to be very easy to read. They're short, they're a page or 2 at the most, and provide information here. You see for physicians what kinds of exams and blood tests they should do, what laboratory tests, and references so they have enough scientific knowledge and they can look further, how to counsel people, how to do follow-up screening. And we have a lot of other kinds of material for the general public and for academics and for residents. Fact sheets, how to reduce your exposure, what are the health effects, what are drinking water guidelines like. So if you want knowledge, this is the best website to get it, especially for health effects and health prevention. And this is a flyer from one of the recruitment efforts that we were doing as we recruited children, because we were following the work of our colleague Philippe Grandjean, who had shown in a very important cohort in the Faroe Islands that children with higher levels of PFAS have lower responses to the DTaP vaccine, very important childhood vaccine for diphtheria, typhus, and pertussis. And those results really prompted us to do the same. And that's what we were looking at in the epidemiology part of this project. Another place where activists were very central to science was at a more national level. They testified throughout the country at several town meetings that the National Academies of Science, Engineering, and Medicine had when they put together a PFAS panel. And not only did they testify, but they were brought on board as community liaisons and advised the National Academies how to do this work and how to conduct their study. And not only did they testify, but they also said, look, we're afraid that the results of this panel may be that you don't recommend blood testing and medical monitoring, and that you don't take a very serious position on how strong the health effects evidence is. And because they pressed so much through the community liaisons, they were very successful. And the result was a summary of evidence that showed very important findings. Some we might want more in that left side of sufficient evidence. So some of the things on the right-hand side, limited or suggestive, many of us believe, in fact, there's very good knowledge of already. But nevertheless, these were very good findings for health effects. And it's a book which is, you can get it in hard copy if you want to buy it, but it's also something that you can just get for free online. They also provided some very important work on clinical follow-up. And again, this was something that the activists have wanted. Make sure that even at very low levels, 2 to 20 parts per trillion, nanograms per milliliter in blood, that you would encourage a very important set of follow-ups. And then above 20 nanograms per milliliter in blood, that you would have even more work in terms of exposure assessment and screening. Another kind of activism I want to highlight a little bit is firefighter activism. Now, so far, we did have a great success. You see Maura Healey signing just last year an act that prohibited PFAS in firefighters' personal protective gear. And that was real important because they're exposed in two main ways: the gear they wear every day, but also the foam that they use to put out fuel-based fires and to train with, and also it's stored in the firehouses and the fire training sites. And this indeed was the source of Hyannis's exposure from a fire training site. So across the country, local unions, as well as the International Association of Firefighters, which is the international for all of the locals, have been very, very active. And the protections for removing firefighting foam from U.S. airports have been very key. Firefighters have been very important in getting the Department of Defense to get rid of firefighting foam that's got fluorine-based chemicals in it. So they've really spurred a lot of new creative scientific work to develop new fluorine-free foams. And they've spurred a lot of research. They've also done an interesting thing here, which is that, here in Quincy, we have the National Fire Protection Association. And this is a group, it's sort of like Underwriter Laboratories. When you look at the label on a desk lamp or an appliance, and it's been tested by UL. Well, the NFPA is the same for fire standards, but they've been always very overly protective to the extent of requiring things that are unnecessary. And the firefighters know that they don't need PFAS in their gear, and nevertheless the NFPA continues to say, look, we're going to keep that in there as a requirement. And even though they don't have any regulatory power, fire departments and fire marshals all over the country take their advice. And when a state fire marshal is trying to put together a plan for what are the fire codes, which then become the basis for community level fire codes, that's what they go to for their evidence. So the firefighters have been really active here. And again, think back to what I mentioned before about the experience of the Nantucket firefighters and their spouses forming a very important group. The last thing I want to talk about in terms of a highly focused kind of activism here in Massachusetts and growing around the country is around turf. And there's a lot of PFAS in turf, artificial turf, in playing fields and in football fields and soccer fields and parks. So they make all this artificial turf out of various kinds of plastics. And there are many, many chemicals in it. A lot of people have been opposing this for a lot of reasons. So there's a lot of crumb rubber, which has a lot of contaminants in it too. But especially a lot of PFAS are in this artificial turf. And this is a poster from one of my faculty colleagues here at Northeastern who just gave a presentation recently at the American Public Health Association conference. And there's so many towns and cities across the country that have started to take this up. And in some cases, like the city of Boston says, look, we're not going to have this artificial turf going forward in new city facilities. In other cases, there's a lot of opposition. And this particular colleague, Deborah Milbauer, who lives in Milton, has been very active there, comes across a lot of activism from parents, who say, look, if we get rid of this artificial turf, our kids won't have enough fields to play on. It's not going to be a very good situation for them. And we don't want the expense of it. But these turf activists are very interesting because what they do is they find out, what the chemicals are in there, how short-lived the turf actually is, and then the fact it gets dug up and replaced, and all the old turf just gets buried somewhere or left sometimes literally on the side of riverbanks, waiting for someone to take it away. And then it deteriorates and it gets into the ground, into the groundwater, and into surface water. And it has a very short life, and then it has a very long afterlife because, again, these are forever chemicals. And while some of the turf may break down, the rest of the materials in them, the PFAS, do not break down. So this is a growing kind of activism, and you'll see a lot more in our own state. I mentioned the Alliance for Healthy Tomorrow, working hard on PFAS in firefighter gear and being successful there, being very active in the task force, and pushing the Attorney General also to join multi-district litigation, which is now consolidated in South Carolina from suits all across the country around the firefighting foam, which we call AFFF for short because it's too hard to say aqueous film-forming foam. Now, I also mentioned NBCC is very active in AHT. One of the findings that we know about is that PFAS are very likely to be a breast cancer carcinogen, and they are certainly implicated already in research showing changes in mammary gland development. So Silent Spring is doing this kind of research, and some states have used mammary gland results to do regulations. I think I've made the case throughout, but the important thing about the PFAS response is the multi-sector alliance. And my colleague Alyssa Cordner and I thought about this way back 10 years ago when we were still looking at flame retardants. And this was literally the year that we turned our attention to PFAS. And we noticed that the uniqueness of this was that you had more partners in this multi-sector alliance than you typically did. You obviously had the affected communities, you had a lot of scientists, and you had a lot of advocate scientists, people who really thought that science and advocacy had to be linked. You also had active military, you had veterans, you had environmental health groups, you had water utilities, which made a big difference. You had state and federal legislators and regulators. You had federal research funders, especially from NIEHS at the time, from EPA when there was an EPA, from supply chain manufacturers, because many of them wanted to make sure that they were not getting PFAS and things that were sold to them earlier in the supply chain. And then of course you had big retailers that didn't want to be selling at retail products that were wholesaled to them with PFAS in it. We had a growing number of lawyers because there was so much litigation, and a very impressive bunch of journalists who were doing work in this field. You want to keep up with this work. Our website has a daily news feed that has all the latest stories on PFAS. This is not the most recent one, but every day I would say on average there's 2 or 3 important stories. We've also written several articles just about the community experience of PFAS and on activism. You'll see here some familiar names. Cheryl Osimo is co-author on one of these. Julia Brody, co-author on two of them, and Jenny O'Hayan, also from Silent Spring, on another, Maya Fitzstevens, who had been in Silent Spring before as well. So those are really good resources if you want to see what we write as, let us say, academic advocacy types. And I do want to point out a couple of really great recent books too that are great for both the science of PFAS, but also very in-depth looks at the communities by two important, well, three journalists, Mariah Blake in her book, and Sharon Udison and Rachel Frazen in her book. They spent a lot of time, many years, going around the country meeting with activists, and they tell their stories quite beautifully. They did a series of book talks here that we helped organize a few months ago, and they're still doing some online book talks every now and then too. So if you can, get a hold of these books. They're really beautifully written. And that's all. It's a great story. The work the activists have done is just super impressive, and I thank you for your time.
Thank you so much, Dr. Brown. I want to encourage our listeners on this webinar. If you have any questions for Dr. Brown, you can put those questions in the GoToWebinar control panel, the section on questions. Just type your question in there and I will keep track of those. I do want to just clarify for my own thinking, but also for our listening audience today, and that is that PFAS-exchange.org has a lot of resources, including access to the webinar that was on for our medical professionals. Am I right, correct on that?
You are, yes.
And
So
we did have
medical
a question.
professionals who want to get credit for it, they have to go through Michigan State, which is now the host of it. But
Okay.
for anybody else, it's a free YouTube video. And we encourage not just individuals to use it, but for them to share it with their local clinics and their doctors and anybody else who could learn from it.
And I find that really incredibly generous in this environment that we're finding ourselves in, to have all of those resources so readily available for our own individual and personal activism, for our own healthcare and for the healthcare of the people that we care about.
I should say also that it's free for physicians. So sometimes you have to pay many hundreds of dollars for each CME course. And this is a way that you could save money. And hopefully the doctors who take it and save that money will donate their money to local PFAS activist groups.
That's a great
That would be my
thought.
suggestion.
I like how you think, Dr. Brown. We did have a question from one viewer around the, should there be a PFAS cleanup target for a Superfund site based on the Safe Drinking Water Act cleanup that's happening right now at the Joint Base on Cape Cod?
Well, so only last year were two of the main chemicals, PFOA and PFAS, added as Superfund chemicals. So that's what we call the CERCLA list. And CERCLA is the official basis of Superfund. And up until then, you couldn't declare a place a Superfund site if you found even the most outrageously high numbers of PFAS, because it had to be first listed for something else. A lot of Superfund sites are listed because of PCBs or of TCE, trichloroethylene, or perchlorate or other things. But you could list a place as a Superfund site and hence get money for cleanup and get expert support for doing that, and to have EPA try to track down the potentially responsible parties. Now that they have put two PFAS onto the CERCLA list, you could declare a site a Superfund site because of that. So that's important. We're also afraid that EPA is going to revoke that, like they've been revoking so much else. But it's definitely a very important advance and something that many people were pushing for.
So one of our listeners is asking about the difference between short chain, long chain. We know that, when we were looking at specific chemical compounds, companies would often decrease the organic chain of the molecule and indicate that, well, that doesn't cause the same hazards that we
Right.
see with the long chain. Can you give an explanation of the difference between short chain and long chain forever chemicals?
When PFOA was first given another nickname, was called C8, and this was based on the 8 carbon fluorine bonds in it. And so it was, 8 chains long. And at that time, some of the others were like 9. So then instead of being oct, it would be nona. So these were long chain. They seem to be very stable and easy to use. They developed short chain ones because they were easier to produce. So they thought that they needed to show that they were making some new chemicals that would be less toxic. And one of the ways that the companies would classify them as less toxic is they would say the half-life in the human body is far shorter. So for the long chain PFAS, it might stay in the body for a couple of years. And for the short chains, it might stay in the body for only a couple of months. And hence that was safe. But we know that, chemicals that we've been concerned about, like BPA, that may have a half-life in the body of just days or hours, are still of great concern because they're entering our body all the time. So the fact that they get excreted quicker than others doesn't make them any less safe. And the incredible pervasiveness of PFAS makes it even more concerning. So you can imagine people, successfully getting rid of their BPA-containing plastic water bottles and other things of that sort. There are some things you can identify more readily. You can buy paraben-free cosmetics and shampoos and phthalate-free products of all sorts. It's very hard to get PFAS-free things because there's so many of them. And while you may make your individual choices about things like dental floss that you can identify very easily, or nonstick cookware, there's so many other things that PFAS is part of that people don't know. Every day we're learning more and more sources of it. So there's a lot more opportunity for so much more to get into the bodies. And also, one of the things we find is that the companies didn't learn from the lessons, right? DuPont paid an enormous fine. They were shamed very much in the Parkersburg, West Virginia situation. But then they developed Gen X and they started just dumping that out into the environment just as quickly and defending it and saying, this is clean, this is better, our product is safer, we're not doing what we used to do. But in fact, evidence very clearly shows that it's being very rapidly dumped, very widespread dumping into the Cape Fear River. So the development of short chain PFAS has really been, while perhaps producing more useful chemicals for the producers and the secondary users, a bit of a smokescreen for the real toxicity of these chemicals. And some of the short chains, are very, very short. And there are debates now, of course, what will we even consider to be a PFAS. A lot of industry groups, as they started to see regulation coming down the pike, were saying, let's make sure we get exemptions and that we consider, certain chemicals not to be PFAS because they don't have enough fluorinated atoms on them. So there are big debates now about that definition as well.
So you mentioned several pretty large-scale studies in the state of Massachusetts, really testing individuals and monitoring their PFAS levels. Where can a Massachusetts resident go to get their blood sample tested for PFAS exposure?
Well, so on the PFAS exchange, there are resources. We have links to a continually updated spreadsheet so that when things change, and new labs make things available. When prices change, you can track those down. But you or I can just order from some of the large diagnostic companies this finger prick test. And you literally just, prick your fingers, just like the way people do with home diabetes tests. And then you're able to send that back to the lab and they'll send you a result of that. If you're fortunate to be in a place where there is a study going on, obviously sign up to be part of that. There aren't enough of those studies. We have the hope in the future with our PFAS REACH team to be able to do more of these inexpensive tests with large numbers of affected communities around the country. So we think that other scientists should follow that approach and seek funding so that they can make that available to people, because people on their own may not do that. And if they do, they may not get the level of detailed report back that Silent Spring and its colleagues have always given when there is any kind of testing. So very thorough report backs that show how you compare to national levels or to state levels or to other people in the same sample, the same group that you're part of, as well as a lot of exposure reduction material and information, and also information about like where are these used, what kinds of things could you do at a not just individual level, but at a collective level to seek regulations, to seek state monitoring and other activity. So yes, you can get them, but they're still, we're talking, $400 to $600 a person. So it's not something that the average person is necessarily going to do.
And if you have a private well, right, you're not tapping into town water supply, you have a private well, should you be testing that as well?
I think it's helpful to do that for sure. One of the nice things that our Department of Environmental Protection did was a private wells program. And the DEP did a number of other things too. So much of what we learned about PFAS in water systems, and hence getting into our bodies, and also how to get in the water in the first place, so learning about the contamination sources, all of that was originally just measured in water from an EPA study called the Unregulated Contaminants Monitoring Rule, UCMR. And in the third of those series, the UCMR3, when those data came out around 2015, 2016, it's a time that a lot of attention was now being given scientifically and in regulatory scenarios to PFAS. And so the problem was that they didn't test very small set water systems. And they also had a fairly high level of detection, so they might miss a lot of PFAS that was out there. The state of Massachusetts said, we want to do our own program that's going to be aimed at smaller communities. And they actually identified a lot of places, such as air, that would not have been picked up by the EPA's larger program. So that was a very important set of data. And you can find that on the DEP website. And Sierra Club also, Sierra Club of Massachusetts, which has been very great in PFAS work and science, has mapped a lot of this stuff on their website. Then the state also did a private well program, and they picked communities that had a certain percentage of the population on private wells. I forget exactly what it was. It might have been 30 or 40%, but if you had a decent amount of the population in that municipality on private wells, you were eligible for this private well testing. And then people had to sign up for it, and then they were picked by lottery. They didn't have enough money to test everybody in that community who might have wanted it. But in fact, you could get that. And then they sent around sample kits to people, told them how to sample their water, and then they were, you refrigerated them. They were picked up by a lab company that the state had contracted with, and that information also then was posted on the DEP website. And Sierra Club, I believe, also did some good mapping of that. And this was really helpful for not just individuals, but also municipalities. So, for instance, Truro out in the Cape, when they learned about some private wells being contaminated, immediately said, we're going to start delivering water to your house until we figure out where this is coming from and if we can get some monitoring, remediation system to filter your water. So that's another possibility. It's not just an individual responsibility, but a town could step in and help. And if the PFAS bill passes in the State House, then there will be a fund of money to help in this remediation. So knowing that private wells are contaminated can really also call our attention to the possibility of, like, let's locate some potential local source of contamination. If there are all these wells in very particularly rural areas, like, where did it come from? If they weren't near a fire training site or near a manufacturing site. We're learning now, of course, that one of the most important locations for PFAS contamination actually comes from landfills and wastewater treatment plants, because you're kind of consolidating all of the PFAS that's already out there in the environment. And so you might think you're not near a manufacturing site or a fire station or a fire training facility, but you might be, like, downstream from your town's dump or from the wastewater treatment plant. So those are things that can be pointed to from the private well testing. So I think going forward, we need to encourage a lot more of this, even though there no states or federal rules govern this. Only drinking water systems, but not private wells.
And you mentioned very early on in your presentation about PFAS contaminated sludge that had been used as fertilizer in a rural environment, and that could also be a source, right?
Yes, and it's a massive amount of contaminants in sludge. So this was seen as a beneficial use, right? Let's recirculate all of these materials that come out of wastewater treatment, and we'll take these biosolids and we'll put them and make fertilizer out of it, because they are rich in a lot of organic material, but we've reduced the contaminant level. But they were reducing contaminants that they knew about at the time, not PFAS. When they started to widely use sludge-based fertilizer, PFAS was just not even on the agenda. And it's just really in the last 5 years that we know how much of it is in sludge. So people were putting this on their farms, on private gardens, but for a farmer who, farmers, if they are independent farmer, are living on the margins. They don't have a lot of money to buy fertilizer and seeds and farm equipment and tractors and all the things they need. It's very hard to be a small farmer in this country with agribusiness having taken up so much of the agricultural sector. So they're going to be happy to be getting what they think is something that's helpful to them for free, and that perhaps the local agricultural extension program at a state university has said, hey, this is really good. This is going to boost your crop yield if you use these fertilizers. So they don't have enough information there. The state of Maine was just very out front in doing this, and really passing the first law in the country about how to ban this sludge use and the requirements to monitor sludge. So this is another thing that's coming up. There's a separate bill in the Massachusetts House that will deal with this, and a lot of the legislators from Massachusetts actually did a field trip up to Maine in recent months to learn more about this. And the farmers up there who I showed, they've come down here to testify, and they're probably testifying right now in the State House today.
Wow. So you mentioned one of the reasons that Massachusetts Breast Cancer Coalition, through our executive director, Cheryl Asimo, is so involved with our sister organization, Silent Spring, and with the PFAS task force, has been really about the link between PFAS exposure and breast cancer. From an epidemiological point of view, what are the cancers that are most closely associated with PFAS exposure, and what do we still not know?
Well, liver and kidney and prostate and testicular, the latter especially for the firefighters. I think we know a lot. The health effects literature is quite profound. One of our colleagues in the PFAS project lab, Julia Varshavsky, runs something called the PFAS tox database, which accumulates information from animal and human studies and of all kinds of toxicology and epidemiological endpoints. And so, we're gaining more and more knowledge. I think the interest for Silent Spring and NBCC was not only because of breast cancer, but also because everything learned in breast cancer was about the wider spread effects of endocrine disrupting compounds of all sorts. And so PFAS are very important as EDCs and implicated in so many other kinds of health outcomes. So I think that made it really, particularly of note to them, both the scientists and advocates.
And with one of our other listeners asking the question, is PFAS associated with fertility disruptions?
Yes,
disruptors,
lower birth weight,
low birth rate,
reduced fertility, yes, premature birth. So this is, we're just, starting to get a lot of that maternal and child health effects material. We're starting to see also effects on neurological outcomes as well. So these are some of the newer areas that we're seeing.
And so we've been told through other scientists reporting that, there's a high probability that all of us have some level of PFAS exposure because they are so prevalent and they are forever chemicals. So what can we do individually, not just to reduce further exposure, but to also maybe treat what we may have already experienced as a PFAS exposure?
Well, so the starting point as an answer there is how much of it is in us, how many of us have it. CDC has always had this program called NHANES, National Health and Nutrition Examination Survey, and that's always sort of been the standard that we use to say what's in the general population, for dietary things, for chemical contaminants, and like 99% of us have PFAS in our blood. So basically everybody has PFAS. And some of the stuff that we learned was scientists years ago were going to very extreme parts of the world where there was no use of PFAS, no manufacturing or use that they knew of, and they still found it because it was able to just migrate across the world. And now scientists have even tested it in rainwater in many locations and find that you can see PFAS in rainwater. So it's reached what several scientists have called a planetary boundary. It's kind of exceeded that. It's just exploded so much that we can't avoid it. Like everything else in public health, you have to go upstream. If you're getting a lot of PFAS in the wastewater and the sludge, don't let it get there. Get rid of it. Find alternatives to it. We've had that experience with so many things. You and I know that we can buy the same cleansing product or personal care product in Europe and in the US, and the many toxics like parabens, phthalates are outlawed in Europe. They aren't in the same product, the same brand. People still buy it. Those big companies still make a profit. So you can make a profit. You can have businesses go on and not go out of business if they do this right. You've got big manufacturers, big retailers who have gone ahead and taken that step, and they've gotten PFAS out of their products. So we need to get more of them to do that. We need tax incentives for them to do it. Stop it at the upstream level as much as possible. Once it's there, and it's going to be there for a while, a lot of money for new remediation techniques, things that will be able to filter out not just the long chains, but the short chains, ways to treat it and dispose of it that don't involve incineration, which then just puts the PFAS into the air. So there's so many things that we could do to reduce this. We have, through the Toxics Use Reduction Institute here in Massachusetts, a great source working with companies to figure out alternatives so that they don't have to use toxic substances for the same processes and products that they've always done. So more of that, more green chemistry to figure out how to do this.
More research, more knowledge really to understand the level of extent of exposure. I want to thank you, Dr. Brown, for such a fabulous presentation and for answering our questions. There's still so many questions that people had today that I do believe we're going to have you come back in the future to do another webinar for us so that we can get that information out. I want to direct people to your PFAS-exchange.org as a great site for information to answer some of the questions we didn't get to today. I also want to say that if anyone wants to send their questions to NBCC at nbcc.org, we can direct them to you and get those answers for the questions we didn't get to as part of our webinar. On behalf of myself and the NBCC board and Cheryl Asimo, NBCC's executive director, I want to thank you, Dr. Brown, for this very informative discussion today. And I want to thank all of our many listeners for joining us. For those interested, the recording of this webinar will be made available later today on the NBCC website at nbcc.org. And if you would like to further support our mission of preventing environmental causes of breast cancer, please consider making a donation by visiting nbcc.org/donate. I appreciate your consideration. Have a good afternoon.
It's been a pleasure.
Thank you so much, Dr. Brown.
Bye.